I'll start with a little bit of an opening around this and then turn it to either to Sean for the updates and to Earl for any updates he wants to give. But let me say just a couple of things. As Dr. Gills, and you all were speaking about Dr. Gills, I found myself literally at one moment grinning from ear to ear, just listening to the things that Dr. Gills was talking about and you all were saying about him. And knowing that he's squirming in his seat because he does not like that kind of public accolade. So I would just simply say, Travis, we've said our goodbyes in a more private way, but I will say publicly that I will miss your calming voice and presence and your thoughtfulness, but assure you that the work, and everyone else, that the work will continue. Dr. Bridges is our acting health officer and our acting chief, and will be in place, and we'll make sure that we have some continuity of operation. But Dr. Bridges, like Dr. Gills, did not work alone and does not work alone. We have spoken with Prince George's County, and they have agreed to allow Dr. Ernest Carter, their public health officer, to sign the orders that are necessary to keep our operations running. So the public health orders for testing and vaccination, for example, Dr. Carter will sign for us to make sure we're still in operation and there's no disruption in service. I'll continue to work with the team and working out in front and behind the scenes to try to make sure that things are running on time as necessary. So you can expect you'll see me and hear from me a little bit more often. And I'll be working closely with you all, as well as the county executive and staff on keeping us safe. The team that sat behind Dr. Gills is still in place. Sean O'Donnell, you'll hear from shortly, Kimberly Williams, who does contact tracing for us, the physicians in the department, the epidemiologists in the department, the chiefs and staff across the whole of HHS will be working on this process, have been and will continue to work on this. So it's and we will have close contact with public health officers across the region to make sure that we understand what is going on, not just in our county, but across the state. Those are folks who've been actively engaged in fighting the disease throughout the year and will continue to do so. We are left with a good team to finish the job. Things are going to change. Guidances will change as our circumstances change, but we will continue, as Dr. Gills has often said, to follow the science and to make recommendations focused on keeping all of us safe and tempered by our efforts to understand the impact and address the impacts, the social determinants of impacts on the social determinants of health that our decisions have. We know that it is not just about medical issues, but it is also about sometimes the treatment has its own impact, and we have to be mindful of those as well. Now, I have the challenging task of finding our next public health officer. Those are big shoes to fill and a powerful presence to fill. But we are working on that. We have recruited a national search firm that is already engaged in that process of sending out information and trying to identify candidates that have the skills and the experience that commensurate to the demands of the job. We also will be putting out an announcement. We'll share that with you also that we can distribute that. There have been several candidates who have expressed some interest, and I would encourage those of you who have candidates who reached out to you and have expressed some interest to have them send their information to us here in my office, we will make sure that they get into the queue for that. Our goal is to have someone in place as soon as possible. The pandemic is going to drive us to move as quickly as possible, but we also need a candidate who has the depth of experience to lead a very broad public health initiative. This pandemic, God willing, will not be with us for always, but we do have the healthcare disparities that we've talked about and outlined over the years, and a variety of other issues that need to be addressed. And we need someone who has the capacity to do both of those things, and to juggle multiple balls and to think broadly about those things. So that's our goal, is to find us the best possible candidate in the shortest possible time. And I will keep you all updated on regular progress so that we can put a candidate in front of you all as soon as we possibly can for your review and consideration. So as I said, Dr. Bridges is not with us this morning, so I'm going to, unless there are any comments or response to what I've just said, I will then ask Sean to give us an update, unless you wanted to go next, Earl. I'm not sure what you want the order to be.
I just want to say, in relation to Dr. Gales, before we go on with this, is, I spoke to him on Friday. He knows how much I appreciate the work. An interesting juxtaposition to Raymond smiling during the accolades. I found myself jointly smiling on occasion and tears welling up on others, just as you bring back all the memories of the last almost 20 months and the stresses and the hardships. And so I just wanted to first, just, before we go forward with the rest of that, just recognize the work that he did and the appreciation I have for his friendship throughout the event, and obviously his leadership. We've all spoken on that, and I won't go beyond that, but he knows how important his work has been to me and to the county. So I will allow Mr. O'Donnell to proceed.
Thank you, Earl. I'd like to say, as a member of the public health team under Dr. Gales, I also want to share my appreciation for the leadership and the calming presence he's had with us, the daily input to us as we've attempted to do things that we've never had to do in the county before, and his ability to level set those expectations as we accomplish those missions. So deep appreciation for the leadership he's given us, and we'll continue to carry on as we move forward. So I wanted to share today the latest data on what we're seeing with relation to COVID. Our current positivity rate, the 7-day average, is at 2.6%, which remains at a lower level than we were at the end of August. The new case rates, the 7-day average, is now at 82.3 out of 100,000. That we remain in substantial transmission level at the moment. It is still lower than it was 10 days ago, however. So one thing we wanted to do with relation to these new cases is, I know there's been lots of discussion about breakthrough cases and vaccinated versus unvaccinated. We have began working with our colleagues to look at those relative risks. And I wanted to share that over the last 4 weeks, if vaccinated, the relative risk for becoming a COVID case is 0.14% in our county. If unvaccinated, that is 2.49%. And so that's a 17 times greater risk to become a case in our county over the last 4 weeks if unvaccinated. Likewise, for hospitalizations, if vaccinated, that relative risk is 0.006%. And if unvaccinated, it's 0.135% to be hospitalized. And that is a 23 times greater risk if unvaccinated. So we just wanted to put that in context. I know people sometimes see the data about the number of vaccinated individuals who are cases or who are hospitalized, but it's important to understand the context of vaccinated versus unvaccinated. Over the last week, our county-supported sites have done in excess of 1,300 vaccinations, and we have done 5,685 tests at these county sites, and more than 40,000 across all providers in the county. That's an increase at the county sites of 22% from the previous week. So we continue to see increased interest in testing coming out to both county and other provider sites. And then the final point I wanted to mention, because I know this is dominating the news to a degree, we continue to give third doses for immunocompromised individuals. And we are continuing to monitor the CDC and FDA guidance on the booster shots. We know that federally they've announced that they're interested in moving forward with those on the 20th of September, and I believe the FDA will be meeting this Friday to look at the most recent data. But again, a lot of that continues to be in the media, and we're monitoring that as well. And just as an update, we're continuing to work behind the scenes. Our aging and disability colleagues have been working with local pharmacy chains and the Primary Care Coalition, again, to have agreements in place so that when it's authorized, they can begin supporting our smaller group homes, including our DDA facilities. So those are the only updates I have now, but happy to answer questions when we enter that phase.
The only additional comments that I have this morning, I wanted to talk a little bit about two things. First off, as you will have seen, I believe yesterday we sent an update to the county council. I do have a further update this morning on our employee vaccination reporting. So far, we've heard from 5,666 of our 9,566 employees, which is just under 60%. And of those 60%, approximately 95% are fully vaccinated. We are doing a push this week to get the final numbers corresponding to how many employees are vaccinated, and hopefully we can get many more into the system who report their vaccination status. At that point, on Monday or Tuesday, we will have a further discussion with the employee unions to discuss the rollout of the testing mechanism. Where I do think we have a pretty good understanding is that the testing will likely look different based on the program that's actually where it's being administered. I think it's fairly easy to understand that the testing protocol that you want to do in our correctional facility might very well look a little bit different than the testing protocol we would do in our libraries, for example. And so we are looking at the modalities and methodologies for the best way to do those vaccinations in those settings over the, we'll have something in place, something to just more further provide the council after next week, early next week. The last thing I do want to talk about is youth vaccinations, which I know is relevant both to the public school discussion we're going to be having shortly, but also just a general point for the community. If you will have seen this week, there's been a fair bit of reporting. Dr. Fauci, I think middle of last week, basically went on record saying that he thinks by November we'll be doing vaccinations for 5 to 11, first with the Pfizer vaccine, and then approximately a month later, the Moderna vaccine will likely come on board, assuming the end of the trials are completed and the data looks good and the FDA can review it and approve that. Dr. Walensky from the CDC said FDA is prepared to review that data as soon as it arrives from Pfizer first at the end of this month. And they plan to prioritize that review and hopefully can do a 2 to 3 week review and turn that around pretty quickly. And obviously, Dr. Gottlieb, former FDA commissioner who sits on the board of Pfizer, has said that it is his hope from the perspective that he sits in that we'll be doing vaccinations in 5 to 11-year-olds around Halloween. And so obviously those 3 points taken together give us a little bit more hope that we're not talking about January as was considered at some points, and that we may be talking much more likely about 5 to 11-year-olds being able to be vaccinated in the end of October or November timeframe. And so we are hopeful that that is the case. And obviously, Department of Health and Human Services is preparing to initiate such a program because we do expect there would be a considerable amount of interest amongst our county parents in having those young people be vaccinated, myself included. So I think that's all I wanted to cover as part of our initial briefing this morning, unless Dr. Kroll or Mr. O'Donnell have any additional points that we can take some questions.
Great, thanks. Can I just ask, thank you, Dr. Kroll, since you brought up the search for replacement. I know while I have obviously great confidence, and we all do, I'm sure, in Dr. Bridgers in his new role, as you pointed out, given that the need to have that he's not an MD, and in order to comply with the law, you've announced that HHS would work with Dr. Carter from Prince George's County for any medical orders that require a physician's signature. Are there any downsides to that approach? I'm just anticipating that we'll have constituents ask how you decided on that approach rather than partnering with an MD at the Montgomery County Medical Society or Hopkins or our hospital network or anybody in the county.
So thank you for the question. I think there are always upsides and downsides to any decision, any direction we go in. The discipline from our perspective is obviously it's someone else's public health officer, which means they're taking on some of our load as we move through the search. But the upside are a couple of things. Dr. Carter is someone who is close to us, operates in a county that is equally sized to Montgomery County and is adjacent to DC, so it's part of our region. Dr. Gales and Dr. Carter and other public health officers in the larger communities have been working collaboratively together. So he knows the issues. He's been doing these issues on the ground for many months. So there's no ramp up. He knows what we're doing, what we're dealing with, what we're struggling with. So it was a small and easy decision to make. Well, not small, but it was an important decision to make, I think, to go in that direction. One of the things we're blessed with in Montgomery County is a raft of people who have expertise and knowledge. And so we won't rely just on Dr. Carter for our background information. We will be using the people that we have here to help us think through any kind of major decisions we need to make, so that we will not be, Dr. Bridgers will not be just left alone. Some of these decisions are not just strictly about medicine and about science and about the medicine. but it's about understanding the science, and with a background and with the experience the team brings to the table, understanding and interpreting the science and interpreting the trends is something that more people have in this system than simply Dr. Gales, and don't necessarily require an MD to make those to read that data and understand that research. So we are confident that this will work for us.
Okay, thank you.
One other benefit, and I think that we've often talked about this too, and the council has as well, in terms of having regional consistency. Obviously, using Dr. Carter provides that benefit too, because then he brings an understanding of what we're doing more closely, as we do from him about, with regard to what's happening in Prince George's County. It will help us with regional consistency moving forward as well.
Mm-hmm. Right. No, we like regional consistency. Is it possible there would ever be a scenario where you all would recommend one medical order and Dr. Carter says, I'm not comfortable with that?
I think that if we're recommending, one of the things that we will do before we make a recommendation on it is have a conversation with Dr. Carter about any misgivings that he might have, and then work through that to see what the best course of action is. So hopefully that will not arise, but if it does, we will work through it until we get to a solution.
Thanks. You all have answered my other questions, except I'm not sure if I heard this one. Looking ahead toward the colder months and the holidays, and the increased gathering indoors during the holidays. I remember this whole conversation this time last year. Are we expecting another surge? And what are we doing to prepare for a surge like we saw last fall, if we expect one?
So I think that I'll start with that and then ask Earl to jump in on it, and maybe Sean as well. I think that it's hard to tell what's going to happen coming down the pike. There's so much has changed from this time last year. We had masks in place. We were just beginning vaccination. Now we're in the place of and as a result of last year, we had a very, very mild flu season. But we were not in classes. We were not as congregated as we are now. So I'm expecting that and I think that we will see some rise. Hopefully the vaccinations will help to minimize that, and there won't be any breakthroughs, any substantial breakthrough from Delta for the vaccine or any other variants that we may be facing. So I would expect some slight uptick in cases, and our prep is, as you've heard, standing up, being able to vaccinate people and to test people, and we have capacity to do that now, and we're looking to grow our capacity to do vaccinations in anticipation of boosters when that arrives.
Great. I would just add a couple points. First off, obviously we have a tremendous level of PPE that we did not have prior to the pandemic. We have made sure that we have a robust stockpile of PPE that we could both utilize within county government and distribute as necessary to partners who needed it, first and foremost. Number two, over the last several months, we've been conducting what is traditionally called an after-action report. That is a total misnomer in this case. We are not after the event, but really it was an effort to not lose all the collective knowledge and to make iterative improvements that we could identify. Now, we didn't want to lose. Obviously, this is an extraordinarily long event in terms of the way we typically respond, and so we wanted to collect some of the information and then make iterative improvements on our planning and processes while that's been going on. So we've been meeting with all the partners who have been involved in this pandemic. Actually, we're going to schedule something with council members as well coming up here shortly. So you'll be hearing from us on that to collect your feedback on that process as well. But obviously that allows us, the opportunity to review what decisions that were made or actions that were taken a year ago or more, and determine whether those would still be necessary and or appropriate in the context of vaccinations and other things that we have in place that we did not before. And obviously, I think, as we've seen, there's been some federal action around rapid testing and other things to make it more readily available, or hopefully more readily available as we move into the cooler months. And that obviously provides us options that we did not have in the past. I think, obviously, we're in the position that because of the circumstances being different than they are, we'd very much not like to be in the place of recommending anything more extensive than we have so far in terms of restrictions or any gathering limits or anything like that. But obviously, we're reviewing that constantly and looking for what are alternatives that we could utilize to, suppress any massive surge, particularly if it related to hospitalization increases, but with it having less of an impact on businesses, because we just believe we have more tools and different kind of environment than we did last year.
Great, thank you. Council Vice President Albornoz.
Thank you. A couple questions and a couple suggestions. So, Dr. Kroll, thank you so much for that update. I may have missed it, but what's the timeline you're working from? When do you hope to have the position in place? Acknowledging there's a lot of moving parts here, but we're talking weeks, months. What do you guys have in mind in terms of filling the position?
So part of me wishes that it was yesterday, quite honestly, as you know. One of the things that's happened is that I've gotten reacquainted with the dark hours and the early hours of the morning for the last 2 weeks, or since Dr. Gill's announced his resignation. I think realistically, we're looking at several months to do this. It's going to be a couple of months. We have to do, I think the search firm has promised us a short list of candidates by the end of this month. And if we can move through that list very quickly, that puts us into October. Conceivably mid-November at the earliest, but my more optimistic, more realistic timeline suggests by the 1st of December. But it would be our goal to try to get someone in place.
Thank you. That's helpful. And we have had, in my office anyway, several associations reaching out to us asking if there were going to be any changes to the decision-making process that we've established and settled on over the last year and a half. There's a rhythm that they're all used to at this point, and let's all hope that the variant or other variants that may arise don't require us to have to issue additional health orders. Let's keep our fingers crossed there. But in the event that we do, could you describe for us, if you can, any changes, if there are any, to the decision-making process now that Dr. Carter will be coming on board and assisting us through this process?
So I don't think that we're looking at any changes at this point. We will still go through a deliberative process of looking at the science and looking at the data and weighing the options about what those decisions need to look like, and conferring with you all in council and with county executive and with the state around all of those issues, to try to get a sense of what is the science telling us, what are our colleagues doing, what looks like it's best practice, and how do we balance between the need to take actions to squelch this virus and the impacts that it has, and while minimally impacting folks in their lives. So that is expected to continue, and those will still come in the form of recommendations from public health to council as Board of Health.
And what should we advise associations? Because obviously Dr. Stoddard has been elevated within the administration, well earned, but I know is still associated with this critically important work. And of course, Dr. Bridgers has been elevated as well. But who should we encourage them to contact from a communication tree standpoint moving forward if they have questions or concerns? What should that look like? And would it be possible, if we could, transparency is very important. We're going to hear in a moment from our partners in MCPS, a lot of anxiety and anxiousness among parents, wondering how decisions are made, obviously questioning in some cases those decisions. But I think transparency and how that process works would be helpful in an FAQ somewhere, or some illustration of who is responsible for what, especially now through this transition, I think would be helpful. But if you could just respond to that, I'd appreciate it.
So sure, for contact issues, I think they should continue to follow down the path. If they were contacting Dr. Gales and sending communications to Dr. Gales, they should go to Dr. Bridgers. They can and should copy me on any contacts at this point, because I'll be working hand in glove with Dr. Bridgers and the team to try to make sure that we are on top of things. And if they were sending information to Dr. Stoddard and questions for Dr. Stoddard, they can do that as well. They could, if they like, copy all three of us, if that makes sense. There are some cases I know where people have gone directly to folks like Sean or other members of our staff. If that's their rhythm, that doesn't need to change at this point. We will funnel that into where it needs to go. But between the three of us, we will take on any of the communications that need to be managed in Dr. Gill's absence.
Great.
Yeah, I would just say my role as it relates to COVID-19 and our response and recovery to it has not changed. Right. So so if there was any question about my change in title, it has no bearing on. I'm still as involved in the COVID work as I was before. In some cases, obviously, we divided and conquered. In other cases, we came together and worked on issues collaboratively. And so depending on the nature of the issue, sometimes Health and Human Services would play the lead role on that issue. And sometimes we work more collaboratively. take examples of the Board of Health regulation that was often done in concert, not just with the Department of Health and Human Services and what my role was in emergency management, but also the county attorney and others involved in that process as well. And so none of that will change. And if you were, as Dr. Kroll said, if you're reaching out to me for something before, you should continue to do so as I'm still filling that responsibility.
Great. Be careful what you say there, Dr. Stoddard.
I know, I'm glutton for punishment.
People still reaching out. But thank you both. And I knew all that, but I wanted our public to hear it. Final question for now. Unfortunately, there's starting to be some mixed messages around boosters that we're hearing in the mainstream media and in the news, which of course doesn't help in trying to get us to that last 3, 4, 5% that we have to vaccinate here. If somebody could describe for us, obviously those decisions are made at the federal level and then funneled down through us through the state. But could somebody describe the decision-making tree as it funnels down to Montgomery County? And once the approval of boosters are recommended, let alone all of the logistics that go with it, that is all us. But in terms of that decision-making, where can we point? What can we tell our county residents who are hearing these mixed messages around boosters and whether or not they're necessary to resolve any concerns that they may have?
So I'm going to, again, Earl and I will tag team on this one a little bit. I think we will continue to monitor the guidance. It is confusing guidance, and it is confusing and mixed messages around this. And we're waiting now for the CDC and the administration at the federal level to align on their thinking and decision-making. We can continue to monitor that, and folks should continue to monitor reliable news sources, certainly continuing to update you all on this and updating the public on any information that we have that is reliable. And on how we will respond to that. And as we get information about how we respond, about how it will roll out and when it will roll out, we will share that with you all, and we will make our plans accordingly. So, Earl?
Just on the science front, what we're seeing is there seems to be universal agreement that there's waning protection to infection, particularly with Delta, but there does not seem to be that much waning protection from hospitalization and death, which is obviously the major intent of the vaccine. And so the dispute, I think, is, or the discussion, or the policy discussions happening at the federal level is largely, is it worth giving people an additional dose to increase their protection against infection, or is it better to focus on the huge swath of the globe that has received no vaccination whatsoever, recognizing that the Delta variant emerged in another part of the world, and other variants may as well. And so obviously, if we're thinking about this from the ending the pandemic perspective, addressing the broader global immunity is what the federal government is thinking about. Also, they also have responsibility to protect Americans to the maximum extent that they can. And so that's the policy balancing issue. Where we fall out in the middle is we're just going to get guidance from the CDC and FDA on when and how to administer any booster that's identified, as as Sean, I think, first talked about, and Dr. Kroll as well. We're already doing boosters in the immunocompromised because that was what directed. So we're hearing the same conversation our residents are about this federal conversation. We're not any more engaged in it than they are, but at the same time, it sort of will do whatever we're prescribed or indicated to do along the time frame that we're indicated to do it, and we're prepared to do that.
The last thing I will say on this is that we are tracking and beginning to get consistent information about breakthroughs. And in this case, so we have a sense of how well Delta is continuing to protect us and where those breakthroughs are occurring. As we get more breakthroughs, we'll have some sense of where the virus is having its greatest impact on us, just as we did in this first round of this as we were doing vaccinations. So we will continue to monitor that, so that as we have guidance from the federal government, from federal level, about what we do with boosters, we'll be able to target effectively what our efforts are to make sure that we are attacking the virus where it's attacking us.
Great. Thank you very much. I yield back to you, Mr. President.
Thank you. Councilmember Friedson.
Thank you. Appreciate all of the work that is being done, so thank you for that. So I'll start with where we were leaving off there. specifically related to the Johnson & Johnson single dose that hasn't been approved yet. My concern and some of the concerns that we're hearing from residents, these were vaccines that were specifically used particularly to target, vulnerable and hard to reach populations because they are single doses. Does the county have guidance on that? I mean, we're now learning, at least for the other two types of vaccines, the other vaccine, because they're really the same type of vaccine, that the booster is necessary at the very least for immunocompromised individuals. The concern, of course, is many of the Johnson & Johnson were used for those who we would suspect are immunocompromised individuals and are likely some of the most vulnerable in our community. Does the county have guidance that we're offering there? Does the state have guidance that we're offering there on how we ought to be handling and how those members of our community should be handling these issues?
Yeah, because the federal government has not opined on whether a booster should be offered or not, we're obviously as a county not in a position to recommend that differently. I would say, my review of the science would say there is good reason to talk to your medical provider and whomever that may be, and talk to them about what the individual decision that you may need to make. That could, that's all I can really go too much into that. But I think clearly the federal government needs to address this issue, and this is an incredibly important issue for them to address, given what we know about Johnson & Johnson and some of the, obviously whether it needs a booster or not is for them to determine. But I think there's enough evidence to suggest that they really need to be taking a hard look at this issue and determining whether, what a booster would even look like for Johnson & Johnson is the key thing is, would you boost someone with another dose of Johnson & Johnson, or would you boost someone with a dose of Pfizer or Moderna? Or that's the issue that we aren't in a good position to determine. But I think there's fairly good evidence to suggest that they need to likely address the potential waning immunity from those people who receive Johnson & Johnson. They have not done so yet. We're not in a position to make a scientific determination with what's sort of out there at this point on that, and would need them to at the federal level to make that determination as the authorizers of the vaccine itself. But I've seen enough evidence to suggest they really need to take a hard look at this and develop a strategy moving forward for it.
You can keep us posted on that. I'm just very concerned. I know colleagues are concerned as well. We specifically use that for those experience homelessness in the continuum of care, those who are homebound, many of whom are severely immunocompromised. And so this is of significant concern, particularly for the most vulnerable in our community. So I appreciate the fact that you're looking into that. We recognize that we only have the powers that we have, but this is something that is of considerable concern. So thank you for that. I just want to switch gears to where the briefing started to a certain extent with the employee vaccinations. The numbers are good for those who have reported. That's positive. But the fact that only 60% of the workforce has responded is really disappointing. And there's an obvious confirmation bias risk here that those who are the fastest to respond are the most likely to have been vaccinated. So we don't really know what the numbers are with the broader population. The responses have not been even, so to speak, amongst different departments, which is concerning as well. And some of the departments who have the highest interaction with the public, and so therefore will be putting the public most at risk, have some of the lower numbers, which is really disappointing. And I just think that it's not acceptable in any way for somebody in the public not to expect that they are being kept safe when they're going to receive public services. And it's not acceptable for anybody who is a public servant who goes to work every day to not expect that we're doing everything that we can to keep them safe. And that includes ensuring that our workforce is vaccinated. So just wanted to follow up a little bit on that. Have there been any discussions with labor partners, not just on the testing regimen, but on boosting those numbers? Because I know that the labor partners have all indicated their interest in this as well. It's a workforce safety issue as much as anything. And if there's anything that labor partners are invested in, it's the safety of the workplace. And so just wanted to know where those conversations were and what specifically the executive branch is doing to boost that 60% number way up.
Yeah, so actually we met with the labor unions yesterday, and the focus of a good portion of the conversation was on how do we boost those numbers up. We're going to actually be deploying personnel, as are the unions themselves. Their members will be actually going out to job sites to help encourage other members to register and provide their information. We'll be taking laptop devices out to, for example, our bus depots, where our drivers would not normally interact with computer as part of their bus driving activities. And we want to make sure we have multiple opportunities this week for them to fill in the information. They largely believe that, frankly, as is probably not all that surprising when you give someone a 3-week deadline. Many people are not. They say, I have 3 weeks, so I'm not going to rush into this. And so we're expecting those numbers to increase considerably. We agree with you that the numbers need to be higher. There's no question about that. And we're working actively with both our employee unions as well as our employees generally to increase those numbers through a multitude of, providing information via email, going out to the job sites and talking to them there. Across the board, we're doing all those things to try and increase opportunities, including maybe even offering some carved out time in work schedules for those difficult to reach employees to actually go in and fill out the information this week. So.
Okay, what is the plan pursuant to the Board of Health regulation that we passed to share the updated numbers on a regular weekly basis?
So I believe that County Stat was working on a dashboard or a database to express the way, I think the way we've been reporting it is, obviously aggregating the very small departments that you can't identify. We have departments, I think the Board of Appeals is like 2 people. So obviously if you knew the vaccination status of the board, you would know individual status. So from a HIPAA protection, we have to keep it at a slightly higher level, but I think that our intention is to offer a dashboard. We agree with you that the story that's being told when you have a very small number of employees is potentially misleading. And so obviously we just wanted to have enough aggregated employees to feel like it's providing a reasonable representation of what the entire employee pool looks like. We're getting to that point and we'll begin to post the dashboard with the information on it as such.
I appreciate it. The Board of Health regulation required that as of August 31st, just to be clear. That date came from the executive branch of a reasonable approach and a time frame for the executive branch to be able to move forward. And we're more than 2 weeks past that. And so I would hope that you move forward very quickly to get that done. The public expected that to be up on August 31st. It's not up. I know that it's now been reported publicly, at least this one snapshot, but this needs to be regularly updated so we can see the progress. We have spent a lot of time using the powers that we have, the example of our power in county government to keep our residents safe. We have to use the example of the power of our example, and our workforce has to step up like our residents have stepped up. And we hope that our workforce similarly has vaccination rates to the broader public, but we don't know that. And that has to be reported, and we have to be held accountable and transparent about that. Just last question here. In light of President Biden's recent actions related to vaccinations in workplaces across the country, is the executive branch looking at this issue any differently, prepared to make any changes in light of those recent actions by the president?
So we're trying to make a determination as to whether the OSHA requirement would apply to us, but regardless of whether it does or not, we're obviously following that policy largely anyway, where we're either requiring a proof of vaccination or a follow-along test. And so I'm not sure how necessarily, and we haven't received the OSHA guidance to make that full determination yet as to how that the federal requirement might interact with what we're already doing on the ground. That said, I think any determination we would make to make a change would be based on the information that we collect this week. And so I think it would just be premature for us to say that we're making any changes to the policy until we see exactly what we're dealing with at the end of this week with regard to the reporting numbers. At that point, may we revisit the policy? I think it's possible, but obviously we won't make that decision or determination until we see the final reported numbers on the deadline that we provided to the employees.
Appreciate it. I hope that we will take the strongest stance we possibly can to keep residents safe who are getting services and keep employees safe who have dedicated their careers to public service. Anybody who is a county employee shows up to work should reasonably expect that everybody's working alongside them is vaccinated at this point, that they're readily available. And everybody who is a county resident who shows up to the county government to get services should reasonably expect that their health is not being placed at risk by going to get those services. So as you review those, I just want to urge strongly that you take the strongest possible approach to this. I don't think that there is any other acceptable option in this regard. Thank you very much, Mr. President.
Thank you. Councilmember Reamer.
Thanks. I want to follow that same thread. I mean, I think we're all pounding the table politically about anti-vaxxers, but we're not doing everything we need to do to deal with anti-vaxxers who are working for our organization and are putting their fellow employees at risk. I don't think Vaxxer test is going to work. You know, I was initially enthusiastic about it because it was something, but as time has worn on, it appears to me that if you're an anti-vaxxer, it's not that hard to take a weekly test. And so it's not really going to change anything for you. So I will look forward to seeing what the results of this are, but I am also concerned that those who have not stated their status are probably predominantly, it's possible they are predominantly not vaccinated. I don't know. Why wouldn't you share your status? So, you know, there has to be real consequences for not vaccinating. And a weekly test is not a significant burden, unfortunately. So I think we got to go further, you know, and again, we'll see what this data shows, but I want to really applaud Park and Planning. They've just put in a vaccination mandate for the police. Chairman Anderson, appreciate his leadership. The Board of Education, although we don't have details, they passed a resolution this week requiring vaccinations for school employees. And I, again, don't yet have the details about a disciplinary escalation to enforce that, but I'd like to see it. And you know, I think we need to be prepared. Well, I think we need to require vaccinations, end of story. And, you know, if you don't want to get vaccinated, then, you know, we don't want you working for us. I'm okay saying that. You know, it's hard to say, but I think we have to say it. And this is about health and safety. So, you know, let's see what we get out of this data, but I think we got to move quickly here. You know, it's the unvaccinated population that is sustaining this pandemic here. You know, we are at like 90% vaccinated among our adults, which is amazing, you know, but at that last 10% is still keeping it going. And any way that we can get all the way, we should. And President Biden has helpfully announced his desire for private employers to start with their mandates. And, you know, I think there's a lot of room for private employers to put whatever discipline they want into that. But certainly Vaxxer test is the weak baseline. But I think we ought to do better than the weak baseline. That ought to be, you know, we need to reach a little higher. So let's, you know, I think we'll need to take this up next week and figure out what information we have. Thanks.
Thank you, Councilmember Novato.
Thank you, Mr. President. So I'm actually going to follow up on what Councilmember Vice President Albernoz asked, which were exactly my questions. I'm glad those were answered. But I think that it seems to me that we do have to figure out how to, in some ways, expedite this process of hiring our health officer. We will be talking, you know, we will be discussing the process with MCPS and HHS, but a lot of these things that we are talking about really are dependent on our own process of making these determinations, the strategy. I mean, it's something that obviously we are all very well versed in, because we've done it for this, past year and many months. But not having our health officer in place, of course, continues to be a great deal of concern, and continues to, I think, also facilitate a lot of confusion out there. So I just wanted to follow up a little bit more on that, and wondering, Dr. Kroll, you did say that you're thinking that, of course, it's going to take quite a number of months. So pleased that we have this partnership with Dr. Carter in Prince George's County. But have there been any conversations or any kind of insights into figuring out maybe like a parallel sort of track if you do get some really great candidates? I had heard of some candidates that had been brought up to you. I think Councilmember Albornoz had brought up to you some candidates. But has there been any discussion with sort of a fast track? Obviously, if candidates are vetted and they're qualified, so that we can put in place a health officer or sooner than later, given that we're still in the midst of the pandemic. Is that something that has been discussed?
Thank you, Councilman.
Or is there a plan for that?
Just as a first reminder that we are naming Dr. Bridgers as our acting health officer in this process, a position that he did hold in another county where the health officer's position was vacated for a period of time. So we will not be without a health officer. You are certainly referring to the fact that there's not a physician in the position at this point.
Right.
But that is, for many of the decisions that we now have to make, it's not as much physician as it is public health that's the driving force. It's not the medicine issue, the medical aspects of how this disease unfolds, but it's the decisions about what we do with that in the face of this pandemic, and that is about epidemiology and understanding those issues in public health. So that's just to reassure the public that not having an MD does not mean that we don't have the capacity to make some decisions. It's the guidelines. That said, to your question about the expedited process, I am very mindful of wanting to do this as quickly as we can, and trying to find someone who will fill the position. But I'm also mindful of the community's need and desire for that to be an equitable approach, and for us to identify candidates that represent the diversity of the county. So part of what I'm doing, and we have several candidates that we are that are local, and the goal is to reach out to them and talk with them, and to maybe jumpstart that process ahead of what would normally be a process of interviewing and vetting and et cetera that we typically do. So when I say December, I'm looking at an expedited process already that could take many, many months. This will be dramatically faster. And if there's a way to speed that up, you can count on it, because I am now waking up at 3:30 in the morning and trying to figure out what's next, and on top of everything else that's going on. So yes, if we have candidates that look like they can be, and there's a way to expedite that process, we will pursue that.
And just to clarify, because I was also, as you mentioned, maybe I was mistaken. My understanding was that our health officer had to be an MD. Are you saying that is not a requirement under state law?
The state law varies from county to county. In our jurisdiction, the health officer and the health officer serves as an MD. We're allowed to appoint an acting health officer, provided we have an MD that is available to do the orders.
Right.
Typically, and we could have made a decision to have changed that, to split those out, I think, except that would have required now 2 job descriptions be developed and 2 whole tracks of work be developed, and that would have added an enormous time frame, more time than I wanted to add to this mix. So,
okay. All right. I just wanted to clarify that, because I know that this is how we are structured, and that was why when we did appoint Dr. Bridgers, of course, it'd be acting because of that. So that's what I was referring to, and I appreciate you saying that you are, of course, doing everything possible to make sure that there could be a fast track process. Of course, as long as you are finding candidates that do have all of the qualifications. And I appreciate your making the comment about, one that reflects, candidates that reflect our community. I think that's really important. But it has been said earlier that we are very fortunate to live in a county such as ours with so many people that have extraordinary qualifications. And I guess this is just a pitch to make sure that everybody is aware that we are looking and that we hope to find a suitable candidate ASAP. I think that will be super important as we're entering this other phase.
I would encourage the council that if you have candidates who approached you and have expressed some interest, to please, again, I'll say it again, to please have them send their resumes over to my office, and we will make sure that they are in the queue and in the pool of candidates. Because I want someone who really understands this county and can work in this county and can tie into all the things we got to get done and can get up to speed really fast.
Thank you. I appreciate that. I'll close by saying that, I also believe that we are fortunate that Dr. Stoddard is continuing to participate in terms of this particular portfolio, because this is a very highly qualified team with Dr. Kroll, Dr. Stoddard, Mr. O'Donnell. It continues to be, I think, a very seamless operation. And so in that sense, I feel confident that we will continue to navigate this process appropriately. And as long as we continue to communicate with our residents in a completely transparent way with the data, we should be good. Thank you, Mr. President. Thank you.
Thank you. Councilmember Jawando.
Thank you. Appreciate the comments and questions of colleagues up until this point. I also am heartened that we have a great team that will be led by Dr. Bridgers in an interim basis, along with your role. Please, thank you for clarifying, Dr. Stoddard, the continued role that you'll have. I've noticed you've been wearing suits lately. I'm used to seeing you in the polo, but I'm still confident in your guidance and advice. So really appreciate that. And Dr. Kroll. So I think the timeline you laid out under the steady hand. One of the great things about Dr. Gales is that it was a team approach, and I know Dr. Bridgers was right in there with you all making all these decisions. So obviously, this is a top, very important job, big shoes to fill. We want to get a wide breadth of depth and experience of candidates, but also move with urgency, as I think I'm hearing you say, to get this filled. I do have a question on the data. I know this is our first time back in a while. Normally we get the screenshot update of the charts and graphs. I think that is helpful for the public. It's helpful for us. And I would ask that, going forward, if we could continue that process. And where can the public go right now? I'm assuming all those dashboards are still right on the website as normal, but I do think it's just helpful for us to have that context going forward. So I'm assuming we can do that going forward.
So the standard dashboards that are on the website are continuing to be updated, and the public can go to the websites and get the updates on all the data. You are referring, I believe, in part to the Pulse report that
yes, yeah,
is regularly for our updates to council and to the county executive. One of the things that has happened for us is that one of our staff members, Dennis Lenders, as you all, some of you may know, was our head of our data unit in behavioral health, or in HHS, left this past week. In fact, he left on the same day that Dr. Gales did. Handed it off to our staff members, and I was advised earlier this morning that the Pulse report was ready, but I did not have time to pull it up and review it before we pulled it up this morning. So it's a gap of 1 week. We'll be back in the Pulse report data next week.
Okay, really appreciate that. And you'll send it. Obviously everyone kind of waits for that, and it helps people to visualize where things are happening and what's going on. So I appreciate it.
We will send it to you.
Awesome. And then just related to the employee vaccination, I shared the concern, and I think we need to move forward quickly to assess and understand where that is. But just to be 100% clear, similar to the actions of President Biden, are we revisiting what is the current position of the administration regarding a vaccine requirement for county staff? So candidly, we haven't engaged with the county executive since we made the decision to do the vaccinator test. And I think we were waiting to see, and I think what we've largely talked about is we'll take a look at the data once it's been collated, obviously, to make a determination about how we move forward, whether it's with testing or some other consideration. Candidly, we haven't had the discussion, so I don't know that there's going to be a policy difference in terms of that, and whether it's going to be a mandated vaccines or whether they're, that changes over time. We just haven't had a conversation about it. And we'll do so once we've received the data to say, what is our gap that we're talking about dealing with here? That has implications both for the testing, but any decision we might make about how confident we are that our employees are vaccinated, as you all have alluded to. I don't think you'll hear any opposition from the health team here on the call about having as many people be vaccinated as possible, and that will certainly be amongst our recommendations to the county executive. But we just haven't had that deliberation and won't until we know what the data set tells us we need to do.
Well, I appreciate that. I think I'm of the opinion as well that we should have a requirement. The data is important, but where we are in the pandemic with the cases primarily being with the unvaccinated, the stubborn disparities that we've seen, the disproportionate interaction with county services that are communities of color that are already disproportionately impacted. I think just for all those reasons, to do what the school system has done and the president has done, I think, we need to move forward with either a Board of Health regulation, hopefully in partnership with the executive team, to require vaccination for all Montgomery County employees. I just think that's where we are, and that's where we need to be. I know the county executive isn't here, but I wanted to, take that back. And I think it's good to know the numbers because we need to know that anyway about what's going on. But I don't think we need to wait at this point to move forward with that. So I know we'll have some additional discussions this week with colleagues. I know a couple of colleagues have expressed similar views. So I think I'll be interested to talk with you all and to talk to our attorneys and to the Board of Health, our attorneys that deal with our Board of Health regulations about the authority and how that would happen, because I think that's where we are right now, particularly with the variants coming down the pike. And as the data, for unvaccinated children, I'm really eager to see the 5 to 12 that are all under 10 years old, the 5 to 12, 5 to 11 moving forward. So I appreciate that update, and hopefully we can, get that going as well, because that's the only way we're going to have a shot at this. Even in the vaccination county with the most vaccinations in the country, we're still seeing increases, and so just wanted to put that out there. I appreciate all the work that you all are doing, and look forward to following up on all of these things. Thank you.
Thank you, Councilmember Glass.
Thank you very much, Mr. President, and all good questions and comments from my colleagues. And I just checked the CDC website and saw that 87.6% of Montgomery County's eligible population is fully vaccinated. Incredible work, right? But we're not going to stop until we get that near 100. And I also, just piggybacking off the conversations that have been had, I also appreciate that our chief health officer is required to have an MD. And while that might not have always been the case here in the county, I think it was very forward thinking of us to do when that was mandated. And clearly it has served us well during this pandemic. The only additional thought I want to share is that over the weekend, I attended the Long Branch Festival in the Long Branch neighborhood of Silver Spring. And it was an absolutely wonderful celebration. And one of the great community organizations that was there, Cheer, had a booth. And in partnership, they also invited Holy Cross Health that was there providing COVID shots. And over the course of the 3-day festival, it's my understanding that there were a few dozen people who came and got their COVID shots. And the reason I share that is because the people who were getting the COVID shots there were not anti-vaxxers. There was no political agenda. They're just hardworking people who hadn't made the time to get it. And so as we continue working to increase that 87.6 eligibility rate or vaccination rate among eligible residents, there's always more work that we can do because people are still looking to get the shots. And yes, we do need to make sure that our workforce is fully vaccinated to protect our own workers and our county residents as well. But I know that we're all committed to doing this, even with with Travis Scales leaving us. But one player on the team does set us back a little, but the rest of us are here and we're pushing forward, we're driving forward. And so we got more work to do. But again, the numbers and the data are encouraging, and look forward to the conversation in a few minutes about how we're keeping our teachers, students, and parents safe as well. So thank you very much. I yield back, Mr. President.
Thank you. Councilmember Reamer.
Thanks. Just wanted to follow up on the helpful conversation. Really wanted to express appreciation to Councilmember Jawando for his comments on the urgency of moving forward now. And I'll just share, I had asked staff to draft a requirement for county employees, and we will circulate that as soon as it is prepared, and we can proceed to make it happen without waiting for additional process. If that is what we want to do, which I think that would be a very good idea. So thank you.
Thank you. Councilmember Rice.
Just very quickly, so Dr. Kroll, I know that the African American Health Program, I know that por Nuestra Salud y Bienestar have been working very hard in our communities, and Asian American Health Initiative have all been working very hard in our communities to make sure that we're increasing the percentage when it comes to our communities of color and their vaccinations. I still see via the dashboard that we're lagging at least 50% behind white counterparts when it comes to vaccinations. I was actually on a very interesting Zoom that was with our National Organization of Black County Officials from across the nation, talking about this very issue and talking about something that Councilmember Glass said about being very unique and targeted in terms of our approach. Kudos to MCPS that at their back to school program, in conjunction with my office and with Aetna Health and CVS Health and the Department of Health and Human Services, vaccinated over 250 people at that one-day event. Tremendous opportunity there. And there's so many more. As you heard from Councilmember Glass, every single sort of special event that you have presents a unique opportunity to continue to push those vaccination opportunities forward. And a lot of times, just as you heard Councilmember Glass say, it's not that a person's anti-vax. They've just been, I just haven't found the time. I just, and I'll get to it when I get to it. And when we make it as convenient as possible and put it in people's faces, a lot of them will take advantage of that. And so just curious as to your thoughts moving forward about ways we can continue to address those numbers. Because as we do see the successes, as you heard from a total number of our community that are vaccinated, we still continue to lag behind when it comes to our communities of color. And we know that population is, based on the census numbers, exactly half of our population. So we should have our numbers much higher when it comes to the success rate of those that are vaccinated. So just curious for your thoughts there.
So Councilmember Rice, I want to just first correct or raise a question for you, because our data suggests now that the Black and African American community is within about 3% of the white community in terms of testing and vaccination. We are still showing a lag. And I think, Sean, if you have that pulse report from last week, I was just trying to see if I could find the pulse this morning, and I couldn't find it, but I think we have the one from last week that does maybe show us where we are in terms of relationship to all the various communities that are represented in the county and that we track for vaccination status. But we are much closer than 15%. We have closed that gap substantially. There is still a lag, and it is still a concern for me and for all of the team that is working on this. We have, you talked about events that were going on, and Councilmember Glass talked about an event. I was happy to be at the the event for the Ethiopian community 2 weeks ago, and noted we had testing and vaccination there, and noted that there were family members throughout that day bringing children in to be tested, but also coming in to get vaccinated. So we are still driving forward with that effort. And of course, Salud being a star is, and this will show you where our gaps are, but this shows you we're within 3 percentage points at this point. So that's the data in terms of the Black community in relation to the white community. Of course, the Asian American and Hispanic community, through the help and work of our MHIP partners, have really done a fantastic job. But we will continue to drive forward on that.
Excellent. So I look forward to working with you. I know that Councilmember Jawando is very active in this as well, and working with our African American Health Program to try and continue to provide some unique opportunities. I know that we've talked a little bit about this before, but look forward to talking to you in greater detail about ways we can continue to increase that. Unfortunately, and one of the things that's out there is there's a stigmatization that's out there that our Black community is somehow resistant or hesitant. And I just want to dispel that myth, because that's something that was talked about in that national meeting, was one in which the reality is that, yes, there are some folks that are that way, but it's just like any other group. There's a myriad of different things, and a lot of it relates to, I just didn't have the time. Some of it related to, well, I was waiting for FDA approval, or I don't believe that the vaccine is there. There's so many things that to peg one community is that's the reason why they're not getting vaccinated is unfair and unjust. And so from that perspective, the more we can do to continue to provide opportunities, because we know that there are people out there who still will take the vaccine if they have it, and we can get it to them conveniently and make sure that we're addressing any of the concerns or answering any of the questions, I think is the best thing for us. I know that's what you're pushing for, and I know that's what we're all pushing for as well. So look forward to working with you on that.
Absolutely. I do think that there is, across the board, across all groups, there's a range of reasons that people haven't gotten vaccinated. Hesitancy may be some portion of that. There are folks who just don't necessarily see the relevance in their lives, and have to figure out how we reach out to them and say, look, let's take a closer look, take a second look. As well as, to your point, there are folks who are working and are busy, and to take time off they have not made the time, and it's not convenient for them. So we're still working to make it convenient and put it out there in front of them. We did that a few weeks ago at an event with Reverend Warner and Emory Grove and the AAHP team, doing exactly that, taking it to the community and making it as easy as possible. And we will keep doing that.
Thank you so much. Thank you, Mr. President.
Thank you, Councilmember. That's very encouraging progress with the Black community, Dr. Kroll. I've been very concerned about that, and all of our colleagues have been, and we've done a lot of celebration of the news of our Latino vaccination rate, but that's been on all of our minds. So it's good to see. Councilmember Glass is very much right about the Long Branch Festival, and congratulations to MHP and Cheer and Discover Long Branch, everybody that put that together. I think those are all the comments and questions we have on this presentation. So I think we can move on. Thank you all. And I think everybody, I hope, is sticking around for the next briefing.